www.healthcmi.com. Acupuncture Continuing Education online today. Acupuncture low back pain relief findings confirmed. This was published at healthcmi.com, February 25th, 2021. Go to healthcmi.com, click on news, and look for the article of that name, Acupuncture low back pain relief findings confirmed. Really interesting stuff. Acupuncture is an effective medical intervention for patients suffering from lower back pain, according to researchers from Harvard Medical School, Georgetown University, University of Arizona College of Medicine, and other medical institutions. The findings are based on evidence-based systematic analyses of numerous clinical trials. The research team adds that their determination is consistent with CDC guidelines and the American College of Physicians, which conclude that acupuncture is a first-line medical procedure for the treatment of low back pain. The meta-analysis reviewed important studies, including a 2020 clinical trial of over 550 patients with low back pain. That trial determined that patients using acupuncture experienced a significant decrease in pain intensity levels and suffered from less disability. Another investigation in this meta-analysis encompassed 3 systematic reviews of 54 randomized controlled trials. The total patient sample size was over 26,270 patients. The researchers concluded that true acupuncture produces superior patient outcomes for patients with chronic low back pain compared with usual care, sham care, and no treatment. This article covers a whole lot of research trials. So again, go to healthcmi.com, click on news, and take a look. It also has a nice link to the Acupuncture CEU course for continuing education credit for acupuncturists on low back pain. And we included that link for this article because we noticed the researchers seemed a little confused, citing there were no standards for acupuncture. In reality, there are many standards because they noted that depending on what type of low back pain, there were all these different procedures. Well, see, acupuncture is not plug and play. It's not like you can just apply a set of points for low back pain. It depends if they have disc herniations or disc protrusions, spondylolisthesis, spinal stenosis, facet joint dysfunction, sacroiliac joint dysfunction, arthritis, etc. Dependent on that determines what acupuncture protocol will be used. There's local acupuncture, distal acupuncture, microacupuncture, electroacupuncture, warm needle acupuncture. There's a lot there. And to a researcher, it's confusing because they want one set of points, one standard. It's not that there isn't a gold standard in acupuncture. There are several gold standards. For example, we note that Yao Tong Shui, the special points on the hand, are somewhat miraculous for acute lumbar sprain and strain, but for chronic pain, not really. We even cover the fact that there's 2 main Yao Tong Shui points also in the master tongue system under a different name, but there's even a third one that's lesser used. And that's all covered in the low back pain course. And local acupuncture with electroacupuncture, we cover that. And there's different protocols for different types of electroacupuncture stimulation depending on the presentation and whether or not it's ipsilateral or contralateral, etc. So again, it's not that there's no standards. There are many standards. And this has evolved over many years. So acupuncture is an ancient system, and yet it's a modern system. So there's 2 ways of thinking about it. Well, it's this old system, maybe it's some ancient art. And this romanticization of acupuncture is actually highly inappropriate because by doing that, we keep it at arm's length as something distant and other. In reality, it's part of the modern world. It's evolved over time and it's highly sophisticated. So while it is ancient and some of the ancient language, let's say qi, for example, is still part of the system, that reflects not just the movement of energy as it's translated, but also, for example, balancing parasympathetic tone or balancing brain functional connectivity. So when we speak of things like qi, we can then be scientifically accurate to be exactly specific as to what type of electrical conduction through what specific set of nerve roots emanating the lumbar region are affected. So just because the ancient terms are part of that ancient poetic language does not mean that we don't have scientific specificity with today's research. An acupuncturist understands these things. And that's why it's difficult for researchers. They do look for one set of points strictly for analgesia, and acupuncturists are treating both the root and the symptom. So they have to balance treatment of the root, underlying cause, and the symptom that's presenting. And that's how we produce long-term results. That's why a licensed acupuncturist can do a lot more than someone just using a plug and play, use a bunch of needles and get some pain relief. It is a very sophisticated art form of medicine that is highly tailored to individual diagnostics, and that can be frustrating to researchers looking for one set protocol for a given condition such as low back pain. But that really encompasses a variety of conditions and presentations, even along data points. So someone coming in on the first day with severe pain is very different than someone coming in a week later or a month later. For example, if someone comes in with acute lumbar pain, maybe we do some local electroacupuncture or something, get that pain level down. But maybe if we find out that it's something we call kidney qi deficiency, which sounds kind of wild and otherworldly, but in reality, it's a very concrete set of symptoms. Maybe there's some weakness with aging. Maybe there's impotence in the male, for example. Maybe a feeling of coldness in the low back. Maybe the person's kind of hunched over and very, very weak or feeble. It's a syndrome is what it is. And it has a nice poetic name, but it is a syndrome. Once that's identified, then the acupuncturist may want to use some distal points like Tai Chi, kidney 3, near the ankles, which can have miraculous effects for people with kidney qi deficiency, resolving not just the low back pain that results from it, but all the other symptoms that go along with it. Because it's a condition, it's not just a symptomatic presentation. I would say, in that situation, think of low back pain like the red warning light on the dashboard of a car. We never want that to go off, of course, especially when we're on a highway in the middle of nowhere. But sometimes you get a little pain. Maybe it's a headache. Maybe you get low back pain in this situation with this research. And so it's an opportunity to address the underlying condition. Now, sometimes it really is an old trauma that's being treated. Sometimes it's a systemic problem with internal organs such as the kidneys. But an acupuncturist needs to determine that and then adjust the treatment protocols accordingly. So we added a lot of commentary into this article because the researchers seemed a little confused that there were so many protocols. But if you consider that it is ancient medicine with clinical case histories going back thousands of years and clinical case histories that are modern, even within the last year, even currently, there's a lot of pieces of research going on right now. So when to choose a protocol is a very important choice for an acupuncturist to make, and that really has to do with individual diagnostics. So take a look at this article. I think you will enjoy it. It really clears the air on this. Again, acupuncture is not just pain relief. People enjoy the pain relief. It kind of puts acupuncturists on the map. But equally as important is to heal that condition to prevent exacerbations and aggravations, prevent flare-ups, long-term for the health of the spine, for example, long-term for the overall health of the patient, so that this pain doesn't keep coming back. And that is really the essence of what an acupuncturist is ultimately going for. Thank you for listening. I'm Adam White, licensed acupuncturist. www.healthcmi.com